Hello, I'm Dr. Ankita Mishra. I'm a psychiatrist practicing in Mumbai. Today I will be discussing about the relationship between our thoughts, emotions and behavior. So let me explain this with an example. Imagine you have texted your friend and your friend has not replied to your text. How will you feel? Let's say angry. And what will you be thinking? Probably that he is ignoring me deliberately. Now, is there any other way to look at the same situation? So you may think that he is angry at you or he is upset because you had done something earlier, and this will make you feel sad, guilty, or upset. On the other hand, if you think that he might be busy or he might not have looked at your text, uh, on the contrary, you are going to feel neutral or maybe a little annoyed about it. So the situation is the same, however, your emotions are guided by the thoughts that are going on in your mind. And this in turn affects your behavior at a later stage. So when you meet this friend later that day, if you are angry at him for not replying to your text, you may behave in a cold way. However, if you think that he might be busy and that's the reason why he had not replied, you may just go ahead and ask him about the reason, and things will be sorted between the two of you. So it's not the situation, but our perception, our interpretation about the situation that makes us feel in a certain way, and that control our emotional as well as behavioral response. So it's important to understand at this stage that thoughts are merely product of our brain. They are not facts. They are our opinions or our perceptions about certain things, which might or might not be true. The first step in developing a healthy thinking style is to be aware and mindful about our thoughts. So our brain keeps on thinking from morning to night. In fact, our brain is active even while we are sleeping, and it's not possible for us to keep a track on all the thoughts that are going on in our mind. In fact, most of the thoughts occur at an unconscious level and they are automatic. However, whenever you feel a shift in your emotional state, whenever you are angry, sad, or upset, try to focus on the thoughts that are going on in your mind. If possible, jot it down. Once you are aware of your thoughts, once you are able to identify your thoughts, the next step is to evaluate these thoughts. Whether these thoughts are logical, whether these thoughts are factual, and if these thoughts are true, to what extent are they true? Is there any other alternative way of looking at the same situation? Is your thinking helping you in any way? Is your thinking helping you cope with the situation? If not, what is an alternative way to think about the same situation which will help you cope with it in a better way? It seems difficult at first, but like any other skill, it becomes easier with practice. So if you start learning how to drive, in the beginning it's difficult. In the beginning you have to really pay attention to what you are doing. But over a period of time, it becomes a reflex, it becomes automatic for you, and you become confident about driving. Similarly, once in the beginning, it might be very difficult to identify your thoughts and assess your thoughts. But over a period of time, with practice, it becomes easier. And it is important to adapt a healthy thinking style, because it goes a long way in helping you um, achieve a healthy lifestyle and a healthy emotional and behavioral response to various situations in your life. Thank you so much.